Greetings and welcome everybody to this evening's new Immune 365 Healthy by Choice lecture series, complimentary, where we discuss all aspects of disease. We discuss solutions, we discuss root causes of disease, and obviously validate the risk factors with the quantum devices, the SCIO, the eductor, the QUEXED, and shift people from illness to wellness. And at the end of the day, that's really what healing is all about. But more importantly, we're working from a quantum medicine point of view. So welcome everybody, and just making sure everybody's coming in who's alive and well and wanting to come through. And Rita will be joining us a little bit later. She is currently with Desi right now. And at the airport, I think they're allowing her an hour or so to chat. So I'm sure she'll be coming through and giving us information directly from that. I'm sure a lot of you saw on the Ask and You'll Receive Facebook group information from Desi there. And we'll just be keeping on getting updated on that. So today we're going to talk on the respiratory system, the nose. We've just been following the census for the last couple of weeks, just to keep a pattern going. And today we'll be talking, as I say, specifically respiratory, nose, sinuses, pulmonary problems, and looking from an emotional point of view at sadness and grief, because sadness and grief generally go with the lungs, with the nose, with sinuses. And very important to have these airways cleaned, clear, and working, to maximize your health, because, any obstruction, be it toxicity, environmental toxicity from smoking, parasites, other toxins, mucus buildup, are all going to have, very big effects on the amount of oxygen that enters the body. So what's very important here is to make sure that your lungs as a detox organ and your nose are working to clear the old carbon dioxide, the used carbon dioxide, and the heavy metals and the toxicity when you breathe out. So we're having a problem breathing in. We're not breathing right up to the, right to the bottom part of our lungs. We tend to breathe just in the top half. And the bottom half of the lungs or more is just a pool of carbon dioxide and toxicity, which can get reabsorbed and also create an environment for parasites to grow. I find in my practice that a lot of people have lung infections, lung problems, and don't really know about it. The parasites, you see, you won't really get a fever, a temperature, feel completely out of sorts like you would with a bacterial fungal infection. A parasite is just something that lives subliminally in you, and you're never 100% healthy. And you just go from health highs to health lows and never really achieve optimum health. And you wouldn't know they're there. Most people don't even know the parasites are there. Many of the parasites are genetically modified, genetically engineered as well. And, can be picked up from anywhere in the environment, the food, the water. So those of you who have microscopes, and a dark field and light field for that matter, but specifically dark field, you'll be able to pick up the little organisms, including mycoplasma. So mycoplasma is essentially a TB, which you can see the little round mycoplasma in the live blood very, very clearly, very, very distinctly. And, all of this needs to go. It needs to be flushed out, cleared out. But the most important starting point is the nose and the breathing and getting it in. So I'm just checking if Rita's calling me or not. That's the most important. The most important part is to get the breath in. So we've got 3 minutes to breathe in. We've got 3 minutes you know, and before we take before we die, before we take our next breath. And the value of the oxygen is that it detoxifies us. So within 3 minutes without new oxygen, we die. In other words, the toxicity builds up that quickly. In 3 minutes, the toxicity builds up and we die. So, you know, you start appreciating each breath and the value of each breath and taking a full one. If you're only taking half the breath, you're only getting half the oxygen through. If you've got a lot of mucus and toxicity and parasites and particles in your lungs, you're going to get even less. And then on top of it, if you have a low amount of iron, you're not even going to really carry the oxygen properly. And then if the cell membrane is not optimally charged, minus 95 millivolts, in other words, a cell vitality of 1 or 2, you know, you're hardly going to still then get any oxygen into the cell, which means, you know, it's not really going to bind. There's not going to be enough to bind with ATP to form energy in the cell. So it's absolutely critical that we get oxygen in for energy and then at the same time detoxification. So, you know, that's the real importance. And the lung is a massive detoxification organ. And what happens a lot also is when the other organs are blocked, for example, the liver, the kidney, or the gut, or the skin is blocked, there will be an overload of toxins that then need to come out through the lung. And that's when one tends to get sore throats and respiratory infections and things like that, more so than normal. So it's always important to keep all the detox organs absolutely squeaky clean, clear, and operating to their maximum ability. And then you don't overload the lungs. So, you know, the airway is critical. Also, for oxygen transfer, you need to have you do need a healthy mucous membrane, and flaxseed oil is excellent to bring in to line the respiratory mucous membranes. Included is the gastrointestinal tract and the respiratory tract. So we like the cold pressed flaxseed oil with the highest life force of all the oils to be taken on a daily basis for lots of reasons. Included in that is the charge of the cell membrane, the membrane potential across the cell membrane. So we really do need flaxseed oil, and that's where the bacteriophages live. They live in the healthy mucous membrane of the lungs. And when you start getting unhealthy mucus buildup, that's when the slime covers the lining in the bronchioles and in the lung itself, and then you will not get absorption, and you will start getting the parasites living in the lungs. So, you know, very important to have very clean lungs. And then when the oxygen is transferred over through into the blood, we need to make sure that we have enough iron, hemoglobin, to bind and carry the oxygen to the cell. So if you start joining the dots, you can see how many things there are that can actually, you know, go out of alignment and affect our breath. So we have to do every single thing we can do possibly to get oxygen in. If we have low oxygen, it leads to high blood sugar, blood pressure, metabolic disease, weight, and then problems with hormone secretion, etc. So it's essential to get the oxygen through. So blocked noses, people that do mouth breathing, you know, have a very big problem. They do not get enough oxygen in, and also they don't produce the nitrous oxide that you get when you breathe through the nose. So very important to breathe through the nose. And, you know, some of the diseases, apart from infections, which is a very big problem, lots of pneumonias, you see a lot of that on the quantum device. So let me see if what Rita's saying if Rita's saying anything to me. I just want to send her something quickly. It's just, okay, fine. Let me just get that to her. we go. I'm not sure if she'll absolutely will meet with us, but you never know. Depends how long they give her to speak to Desi. So infections need to be dealt with. You get other conditions. You do get a cystic fibrosis of the tissue in the lungs. Asthma, you get allergic and non-allergic asthma. And, that's also always questionable, because I find that most of the time it's a buildup of toxicity. And it's known and labeled as allergic or non-allergic. And if it's allergic, it's seasonal and all that, and that's true. But it just really means that the barrel of toxins is so full that and the lungs not operating optimally to secrete and excrete the toxicity. So I always tend to not label that, but fix the root cause rather. Chronic obstructive pulmonary disease. This is quite common, and it's very, very serious. We can treat it well on the panels, on NLP. Look, we've had lots of success where we use the oxygen drops and DMSO, and people go off the oxygen tank and they start gardening and breathing properly, and it's really, really beautiful to see that. So we also get the scleroderma quite a lot, where there's hardening of the tissue, bronchial infections, upper respiratory infections, damage to the ciliary, the little fine nasal hairs and hairs in the respiratory system. That can get, you can get primary dyskinesia there, which is damaging. And then not to rule out air pollution, because air pollution is a very big problem. Let me just see here. Is a very big problem in most cities. And all you need to do really is go into the country for a day or 2 or 3. You'll suddenly feel your skin starts flourishing, and your body too, because the percentage of oxygen is just that much higher in the country. So those in the city, of course, sometimes it's necessary to have the extra dose of oxygen, once or twice or 3 times a day. I find it very, very beneficial. So, air pollution is a big problem as well. And then, as I said earlier, the emotions surrounding the nose and the lungs. Respiratory system being sadness and grief, and you can normally speak to your patient about that, and they will tell you. So some of the foods that are excellent for, let me just see, this is ready, the slides. I think so. I can show you 1 or 2 slides where I put together some foods. So this is us today, and here are some superfoods and herbs for the respiratory system. It's not exhaustive, but it really does say a lot. So almost gold is a superconductor. We talked about it many times, and it's minerals. Minerals are important for everybody. We need a mineral charge first and foremost. So it's got in the M state, the single state. Gold, silver, copper, nickel, iridium, palladium, cobalt, ruthenium, and a few more. And these minerals are lacking in the soil and the food. So very important if you can get hold of the almost gold. It's all these products are available on the 365 Healthy by Choice website. And, they can be ordered. So I really, really do recommend that top of the list, because of the mineral content. And most people, as you know from your devices, are deficient in many minerals. Those would be the platinum precious metal minerals. And then the Cell Vitality OxyMinerals, which is the oxygen drops. DMSO, it's got the oxygen sitting there, also the sulfur for detoxification, and very important, or the powdered MSM. Most people are also low in sulfur. So it's incredible for that. It's a very high in ormus. DMSO is very high in ormus as well. It's tree sap. And then we have what we call a supercell oxygen. I think Desi's got an oxystim. And that in my one, it's got the Cordyceps Siberian ginseng. And that, along with the bee pollen in the bee mix, actually enhance the absorption of oxygen and the utilization of oxygen in the body. So nice to have that product, especially with people if there's chronic obstructive pulmonary disease and so on. If the cells are battling to absorb oxygen, very useful. And you've got other products like Irish moss, which form a little bit of a mucus membrane inside the lung. Very important for oxygen transfer and immunity. And then the cold pressed flaxseed oil we've mentioned, and I would say about 1 to 3 tablespoons a day. And then your vitamins are very important. They are enzymes actually necessary for all the pathways in the body. And selenium, quercetin, resveratrol. We've always alpha-lipoic acid, NAC. Those are very important for optimum functioning. And then to reduce heated oil, because that's just not conducive to health. That they hang around in the blood and they slow the blood down, which means that the oxygen per minute to the organs is slowed down as well. And when that happens, you start getting, organ trouble and end organ failure, in fact. And so it's a very big problem, heated oil, processed food. So, the usual whole foods, very, very important for the lungs. And the lungs also, all the broccolis and the cauliflowers, and the leafy foods, very good for lungs. And then a Mediterranean whole food diet, always recommended. Enzymes, digestive enzymes, also critical because they dissolve the mucus buildup. Another product, Triphala, which is 3 fruits, which is a natural enzyme contained in the 3 fruits, also critical. It actually breaks the biofilm which surrounds the parasites, which protects the parasites. So if we can break that biofilm, that's really good. So enzymes too. And then, we've got a para-immune defense, which has got about 7 or 8 top antifungal, antibacterial, top herbs in that to do that. And medicinal mushrooms as well. Tahibo, for example, powder arco. And then lifestyle is critical because we all know exercise, getting the cardiovascular exercised, getting the blood circulating, oxygen to the cells, and waste moving out of the body. So exercise, sleep, sunshine, earthing, grounding, sleep before 10 because of the serotonin and melatonin cycle, and nature. Those things very, very important. If you sit too much all day and your posture is out and you crunching over the stomach and the diaphragm and the transverse colon and you squashing the lungs, it's not easy to get a good supply of oxygen through to the body. So, I hope I've given you some good information there. Daisy spoke a lot in her previous videos, which, by the way, are all on the Jane McKenzie YouTube site, particularly last year and the year before, where we went through the whole IMUNE program. We went through all the classes, all the lectures, and there you will see the Wim Hof exercises. So go and have a look at those. Also on the IMUNE course, which is a 100-hour diploma, it's 600 euros and a mentor's 480 euros. You can buy that course on the 365 Healthy by Choice site, and you'll be sent the course material and the textbooks. And there you'll find a lot on the eyes, ears, nose, gut, all the senses, anatomy, physiology, and emotions, how to heal people. So it's an unbelievable course, in particular the information on quantum entwinement, and what we're really doing with our devices. So I think you all know that by now, but it's very important to be licensed, because then you're protected medically and legally. So it's just very, very, very important to do that. But I think also, if you take your profession seriously and quantum medicine seriously, you want to be at the forefront. You want to know what you're doing and be able to speak with conviction as well. So that IMUNE course is very important for all of us to do. And I just want to show you what's next, but it just disappeared. Where did it go? I just have to call it through again. It seems like it disappeared. Sorry. Just going to get it back. I want to show you the new design for the time crystal, which is absolutely beautiful. Just let me find it. There it sits. Okay, I'm just going to pull that through again. I think maybe I pressed the wrong thing there. Yes, so the scalar wave device, I'm just getting mine. All right, the reason it wasn't on me is because I was taking photographs for tonight. So here is our new design. I'm just trying to get it to a point where you can see it. So absolutely beautiful. Andras has done a phenomenal job. What's really nice is at the back, we have engraving now. So each time crystal now has its own unique number. So nobody will be able to, try and copy any of this. You will have your own number. It's more solid. It's more water resistant. And what Andras has told me to share is that should it get wet, the gold leaf, which is decorative, all right, you can see the gold and the silver may not appear anymore, but the time crystal is embedded in the orgonite. And nothing can touch that. No water can get through into the orgonite. So nothing will happen, should it get wet. So I just think this is just absolutely amazing. It's solid. It's male and female. It's quite thick, as you can see. And just beautifully made. So those of you that are looking for a 24/7 scalar protection, you have it. Those of you who are looking for emotional clearing, moving into the past, moving to the future, coming back to the present, resetting your, where you're going, your goals, your making sense of where we are right now. This is what it does for you. And we've all worn them, and we are all we've all experienced the same initial kind of rearrangement of your scalar wave, and then it sets. And it's a wonderful protection, including radiation. So this scalar wave is what we're made of. It's what we are, same as the plants and the trees and flowers and animals, etc. It's what we do when we on the quantum device. We're resetting the scalar wave. We're clearing away toxins and realigning. So this is beautiful for, in between quantum sessions, offering yourself and your clients 24/7 exposure. So we've done, before and afters on the radiation, and it's unbelievable in 1 week. So let's just go and have a look here at what I wanted to show you. Those are the foods, and then so here we have it here much more clear for you, and you can see really beautiful. It's almost the flower of life. And as I said to you, that gold, don't worry if it disappears, if you do by mistake get your time crystal wet. it still works because underneath the gold is the organite, and the crystal is set in the organite with the magnets, with everything. So nothing can get dislodged, even if it drops. And then there's the serial number, and it's encased in stainless steel. Stainless steel is supposed to not stain, all right? So, well, we get the best quality we can. And, you know, a bit of steel cleaner on the back if you felt it necessary would be great. But I think you agree, you know, male and female now. It's covered, it's beautiful and nice and solid. So that's $545 US still, just by the way. So we'll see when Desi comes out, if, well, you know, if anything changes on the price, but I would get it now. Also, there are bulk options on the 365 Healthy by Choice website. You can only get the time crystal from the website. Okay. And so you will see bulk options, you will see affiliate options, and well, you can buy one or two for yourself as well, or whatever. I actually bought one for each of my treatment rooms. So each treatment room has a time crystal, because the scalar wave will fill the room. And I've noticed, and we've talked before, that when I'm doing live blood analysis, I'm very close to the obviously to the slide and the microscope and everything. If I don't work quick enough, the cells start opening. I start charging the cells with this automatically. So I need to work quickly to show the client what the status of their blood is before this device starts working. So people that are in the room with you, in the treatment room with you, are in the scalar wave. If you have animals with you, they're in the scalar wave. If your family is sitting around you, they're in the scalar wave. So everybody's benefiting, and then obviously vibrating at a much higher level. So, you know, that's the space we're working in, and we're working in life's continuum, you know, into the past and into the future and so on. And many people have, you know, given me stories about seeing their future clinic and coming back to the present and then starting to manifest it. So lots and lots of people who travel have noticed much less jet lag. It's seamless. Everybody else is flaking out from the jet lag, and they're not. You know, so that's also, you know, indicative of the strength of the scalar wave, this permanent scalar wave. So all credit to Professor Desiree Dubonnet for bringing us what we need right now. And we really do need this, and we really do need it for the insight, the inspiration, you know, to guide us in our decision making, to make intelligent decisions. Think clearly, living productively. So this is a wonderful adjunct for me, for my products, for the 365 Healthy by Choice products that we use after the quantum assessment as well. So I noticed also when I put this on first, my pineal gland absolutely just blossomed. I could feel it absolutely opening up. So that's what I wanted to share with you there. And then I think I've just got a last slide for you. Let me open again. All right, that's the devices. And then just, oh yes, information on the IMUNE Diploma course. So that's it. I mean, you know, with Professor Desiree Dubonnet, we are leaders in quantum medicine, leaders in quantum therapy. It is the real thing. And the IMUNE course is a course to really get you thinking. There are tests, there are exams. It's not a question of throwing a whole lot of money at a course and getting a certificate and then calling yourself a quantum therapist or whatever. You will understand, because you immerse yourself in quantum space, quantum therapy, scalar waves. And many of the chapters Desi has rewritten. For example, anatomy, physiology, she's rewritten the chapters. It's not how the old textbooks depicted it all either. So very nice to learn from as well. Lots of videos and sound and visual. So you can get all of that on the 365 Healthy by Choice website.